Hello, everyone. My name is Jalen, and today my topic is about how COVID-19 is affecting the Black community. COVID-19 is affecting people of color and minority groups because of race, gender, and economic standpoints. I don't think that that's right, that we are not being taken care of because of our race and something that we can't control. Medical News Today is also reporting another quote. The pandemic persists, and the impact that COVID-19 is having on specific racial and ethnic groups. And according to Medical News Today, they're also saying that the Black community is only 35% of the United States population and 58% of COVID-19 deaths. These numbers are so high. And and to compare, white deaths are only 24% and Hispanics 51%. So our numbers are very high. The CDC, or the Center for Disease Control and Prevention, are saying that this situation is long-standing, and they're also saying that this work reveals that, quote, a number of white medical students, doctors, and residents hold false beliefs that biological differences between Black people and white people. This all means basically that some people in the medical field with no evidence at all believe that people of color, especially Black people, don't feel pain or don't feel pain like people of non-color. And this research also says that, I quote, some believe Black people's skin is thicker than white people's skin, and that white people feel pain worse than other people do, which is not true, and there's no evidence. These are just racist beliefs. And I believe that this goes far back, and this was even happening before COVID-19. I personally learned from people that I know that when they go to the hospital and they're not feeling good or they're sick and in pain, sometimes doctors don't believe them, and that they're just trying to get drugs when they say they're in pain. And I heard this from multiple people, and that this is just a very sad situation. And another article says, I quote, after 2016, when President Trump took office, he dismantled the Pandemic Response Unit, which is to help hospitals, prisons, and urban neighborhoods. And urban is a code for black and brown communities. We need to fight to get people of color the health care they deserve, the doctors we deserve, and to get rid of these false beliefs that probably killed millions of people so far. We also need to make sure that we can afford the medicine, and that we also need to realize that they're saying that the older you are, the more at risk of getting COVID you are and dying from it, but researchers are finding, and that I'm going to quote from the Pew Research Center. They're saying, I quote, in healthcare access, the outcomes rates among Black people between ages 55 to 64 years old are higher than white people 65 to 74 years old, and death rates for people ages 65 to 74 are higher than white people ages 75 to 84. So it's not really making sense, especially to me, on why they're saying that the older you are is you're more at risk, but people that are not of color are older and not getting COVID or surviving COVID than younger people of color. Thank you for listening to my podcast. Again, my name is Jalen. Thank you.